So there's a disorder that's called exploding head syndrome. It sounds really scary, right? Your head doesn't literally explode, but it's a parasomnia. So it's like a sleep disorder in which, some people, when they're starting to transition into or out of sleep, they hear a really loud sound.
Hey everybody, before we start the show, I want to make a couple disclaimers. This show does cover a wide variety of topics related to mental health and life in general, and some of those could be sensitive for you. I want to simultaneously encourage you to be brave in consuming difficult content, but also respect and recognize your limitations. So please use your best judgment. I will never be offended if you need to skip a question or an episode entirely, but feel free to feel it out, check out the episode, and just see what happens. If you need to skip, that's okay, but feel free to give it a shot first. I also need to say that while I am a psychologist, I'm not your psychologist, and I'm not your therapist. This is not intended to be direct medical advice, and you should not use this as a substitute for professional help. So with those said, let's go ahead and get into the show.
All right. Hello, friends of all varieties. This is the Hardcore Self-Help Podcast, episode 340. I'm your host, Dr. Robert Duff, aka Duff the Psych. I make mental health content for real people, just like you. And today I have a question and answer episode for you. Two really good questions. Nothing, too intense in terms of potentially triggering things, I don't believe. But definitely some interesting questions that I'm happy to answer here. If you would like to send me a question to potentially answer on the show, please shoot me an email to duffthepsych@gmail.com. Or you could use the contact form on my website, duffthepsych.com. And I have to say, so episode 340, we're getting up there, guys. Like, I was sending a previous episode to somebody just as a reference, and it was episode like 170 or somewhere around there. I'm like, holy crap, that was a long time ago. I forget that I've been doing this podcast like forever now. So, I don't know. I appreciate your attention as always. If you've been with me, kind of from the start, like, you're awesome. If you're new, you're also awesome. But I appreciate anybody who has taken the chance to listen. Special shout out to those of you who have left reviews for the show or shared it with a friend. Always appreciate that. If I sound a little bit quieter, that's because I am. It's almost 11 p.m. I've already had a very busy week, and then I'm kind of like taking off for a while tomorrow after work. I'm going to go see a concert. I'm seeing the Wonder Years band in LA, which I'm really excited about. And then I'm going to be going to Disneyland the next day. So I needed to get this done early and out there. So this is the time that I have to do it. But I'm happy to, because these are good questions, as I mentioned. So whatever you're doing, hopefully you're taking good care of yourself, and let's just jump in. Here's the first question. It reads, "Hello, I have OCD, but something that does not let me pass over it. It is the fact that when my intrusive thoughts are at maximum, I try to get rid of them. My mind is full of intensity, and then at that very moment, sometimes the TV makes noises just like a click. I thought there is a release of static energy in TV due to electric waves liberated by my brain. Sometimes when my thoughts are against a person, it starts sighs or cough. Once I was woke up 3 times in an hour by my intrusive thoughts, and every time the TV clicked, the TV turned off. So the fact that some paranormal events accompanies my OCD, I really think if my thought can get real. If you can give my advice, we'll be grateful." Okay, so first off, thank you very much for writing in that question. I think there's a lot of good stuff here. One thing I want to say off the top is this is not a judgment of you, but I think it's relevant to the topics we'll discuss here. In the question you wrote in, I noticed there are a lot of misspellings, right? Something like 10 plus misspellings, and the way that the question is phrased has a somewhat disjointed quality to it. So like I tried to read through the question as best I could, and you could probably hear if you're listening, if you're not the person who asked the question, you can tell kind of stumbling over the words a little bit. I didn't read anything other than what's written here. So that's kind of how it was written, meaning there is a little bit of a sort of disjointed, maybe disorganized quality to it. So I tried to read through it the best I could, but there may be some things that I'm misinterpreting here. So just please be aware of that. But here's what I basically gathered from the question. It sounds like you have OCD, and this is something that you've known about. But it seems like the symptoms are getting more pronounced to the point that you're having a hard time ignoring them or moving past them. And it's getting to that point where it's interfering with your life in terms of your sleep, possibly you're functioning with other people in important arenas in your life where it's actually causing you issues. Now, there is an interesting symptom in which you feel a buildup of intensity before there's a click noise that seems like a static pulse from the television or something like that. You referred to this as a paranormal event, which, if I'm interpreting correctly, means you sometimes feel like your thoughts manifest real reactions from the external world, like your brain does something to the external world, if I'm interpreting it correctly. So I think there's a good amount to unpack here, but first I want to let you know that I really appreciate the question. I get a lot of different types of questions on the show, and I imagine that for some people it can be a bit intimidating to send in a question, especially if it has elements that make it a little bit different than other questions that I've answered. Like this one, there's some pretty strong symptoms, some unusual experiences and things like that. So I'm happy to have the opportunity to talk about something in this realm. So let's talk a little bit first about just OCD, so obsessive compulsive disorder. Of course, I've discussed this on the show a number of times, but some things do bear repeating here. So with OCD, obsessive compulsive disorder, you can have either obsessions, compulsions, or both, and they are often linked together. So obsessions are intrusive and unwanted thoughts. They're not delusions, meaning, like a belief about the world that you stand by. They're intrusive and they're unwanted, so they don't fit with who you are as a person. They're out of place, and they typically cause some sort of distress or fear or discomfort in the person experiencing them. And they can be all sorts of different things. People can have intrusive thoughts that they are ill, like that they've fallen sick. Can have obsessive thoughts about someone you love that might be, in danger or potentially getting hurt. You might have your own intrusive thoughts that you might hurt somebody else. They're not always violent in nature, but that is a common one. It can really be anything, but it's this sort of intrusive, unwanted thought that pops into your awareness and, freaks you out or makes you feel, uncomfortable in some sort of way. And then compulsions are behaviors. They're often repetitive in nature or highly specific in some sort of way, and they serve the purpose of reducing discomfort in the person. This is different from like stimming. It's like self-stimulatory behavior that you might see in somebody who has autism spectrum disorder. So that would be a repetitive behavior or an action that's sort of self-soothing. And compulsions with OCD aren't exactly self-soothing. It's doing something that's not logically tied to the anxiety or the discomfort. It is meant to reduce the discomfort, but it isn't like logically tied to it. And they are often linked to the obsessive thought, meaning the compulsive behavior might serve the purpose of reducing the stress or agitation caused by that obsessive thought. And with like compulsive behaviors, there's often an element of what I would call just so, meaning like you got to find the just right feeling. And it's kind of hard to explain, but somebody, engaging in compulsion might continue to repeat that compulsion over and over until it feels right. And typically it never feels perfect. It doesn't feel perfectly right, but they know when it's not right. So it could be something as simple as locking the door and the thunk of the deadbolt, like, no, that wasn't right. Let me do that again. God, it still doesn't feel right. And you just keep doing it over and over until you get distracted or you've given up on it, or it just hits enough of that rightness to let you move on from it. And typically, what you get from that is a little bit of relief. You get a little bit of symptom relief from the anxiety or the discomfort, but it's really quite temporary. It doesn't actually solve the issue. It's just sort of a temporary thing. And like I said, they can really be tied together at times. So with all of that said, let's talk about your particular situation. You didn't mention what your obsessive or intrusive thoughts are, but you did mention that they tend to be intense. And for people with OCD, often there's this buildup that happens. a typical picture would be an intrusive thought comes to mind. And at first it's not, too intense. It's possible to just let it be, to not engage with it. But then it starts to kind of grow. It gets bigger and bigger, and you feel an increasing sense of discomfort. And that discomfort wants a way to dissipate. You want a way to get rid of that discomfort. And that is what causes you to want to engage in that compulsive behavior, right? So you have the thought, it's making you not feel good. It's making you feel kind of itchy on the inside, and you want some relief. And for some reason, in the way that your brain is working, that compulsive behavior, whatever that might be, whether it's directly tied to it or not, seems like it's going to be the thing that's going to give you that relief. But you might not want to do it, right? You'd be like, I don't want to do that. This is something that doesn't fit with me as a person. I don't want to be having to engage in this compulsion, but it keeps building, right? And it's like I said, that itchiness, like you can't really stand it anymore. And then you start engaging in the compulsion. So that's kind of like a typical picture. Sometimes it's not even that drawn out. Sometimes there's not even that much resistance to it. It's just like, boom, fall straight into the compulsive behavior. But yeah, often there is that buildup. And so what you said in your question about the buildup to full intensity, as you put it, falls pretty well within this description. Now, there are some pieces here that I don't know perfectly fit, which is the OCD description. And I'll get into those really quickly after talking about one of our sponsors today. So on the podcast today, we have MindBloom back as a sponsor. When you're dealing with mental health difficulties like anxiety or depression, it can be really difficult to find the right tools to help you out. When you've tried therapy, various medications, lifestyle changes, and you still feel stuck, it can be really disheartening. But there is a new tool that you can use to improve your mental health, which is at-home ketamine therapy. MindBloom is the leader in at-home ketamine therapy. They've safely helped thousands of people overcome their anxiety and depression. Unlike traditional talk therapy, ketamine works very quickly, and unlike traditional antidepressants, it doesn't have a very significant side effect profile for most people. In a study of over 1,200 MindBloom clients, 89% reported improvements in their anxiety and depression after only 2 sessions. So that's pretty darn quick. As I mentioned before, my wife is currently going through a course of treatment with MindBloom. And we're definitely going to talk about that and discuss it in a future episode of the podcast. But I can definitely say from the outside, I'm seeing a difference. And she has been reporting a difference. She's been really happy with the results. The sessions are less intense than what you see with IV treatments, but it's so convenient and it's very soothing to be able to be at home. I posted a picture on Instagram a little while back of just, my wife Joelle in our bed with the cozy blankets, with an eye mask and headphones. And there's something really special about being able to do it that way rather than having to go to, a clinic, which they vary in quality. Maybe it's a little bit cold or impersonal. This is very different than that. So doing it in the safety of your own home is a really unique way of administering it, and it seems to be effective. So right now, MindBloom is offering you guys, the Hardcore Self-Help Podcast listeners, $100 off your first 6-session program. What you got to do is go to mindbloom.com/Duff and use the promo code Duff. That's mindbloom.com/Duff. Use the promo code Duff for $100 off your first 6-session program. Okay, so back to your question. I was just saying that there are some elements of the picture here that don't completely fit. And what doesn't totally fit with the OCD thing is that television click you're talking about, the feeling of buildup, and then the television physically or, audibly makes some sort of click. Now, if you had the urge to turn on and off the TV manually, right, like you had to go up there and push the button or grab your remote and turn it on and off, that would be very, very OCD-like, right? You have this intrusive thought that's building, and when it reaches critical mass, you feel like you need to address it by doing this on-off, pushing of the button, which doesn't have anything logically to do with it, but it does serve the purpose of reducing that discomfort. But that's not what we're talking about here. So in this case, I'm wondering if maybe what you're actually experiencing is what we would call psychosis. I know that term can be hard to hear for some people, like it just has a scary sound to it. But essentially, psychosis is just, referring to essentially one of two things, or both, hallucinations or delusions. And in this case, mainly I'm wondering about hallucinations, right? So hallucination being having a sensory experience, seeing something or hearing something, feeling something that's not actually there, not actually happening. So I wonder if in these cases you might be hallucinating that television sound. Despite how interesting it would be, there's nobody on Earth that's actually demonstrated the ability to impact an electronic device, like turning it off or changing the channel with just their mind, unless they have some sort of intermediary. There are certainly controllers that can use your brainwaves to do that sort of thing, but just being in the presence of it and having a buildup of thoughts isn't going to impact the electronics there in the room. And I do know that devices, so electronic devices of various types, are often a common focal point for psychosis. So a lot of people who experience, say, like schizophrenia, they might hear chatter through their electronic devices, like the phone or the radio or the TV. They also might feel like they're being monitored or watched by them. So, that's one thing to consider here. Could there be an element of psychosis? And that doesn't mean that it means you're not having OCD. You can certainly have both. Another thing that happens for some people with OCD is they have what are called mental compulsions. So rather than something that's very obvious to see from the outside and be observed by others, these are more internal. So things like counting things in the room or in the environment, or maybe running through a song or a sequence or a memory in your head in a systematic, repetitive fashion, right? You can't see that from the outside, but you do it on the inside. I would still say, though, that what you're talking about doesn't seem to totally fit that, right? It's not like you are imagining or like running through the image and sound of this thing clicking. What you're saying is that you actually experience it. You perceive an external event happening. So there's actual thing that happens to the TV, or you hear it in your environment, feel it, whatever, and it seems to be seemingly in response to your thoughts. So that's one thing that's giving me a little bit of concern that there could be something more going on here. There are some other possibilities, right? Aside from hallucinations, another possibility would be a neurological issue, meaning something going on with your brain and with your nervous system. For example, this is not me telling you have this by any means, but just, to put it out there, there are various explanations. So there's a disorder that's called exploding head syndrome. It sounds really scary, right? Your head doesn't literally explode, but it's a parasomnia. So it's like a sleep disorder in which, some people, when they're starting to transition into or out of sleep, they hear a really loud sound. And it's described differently by different people. It can sound like a bomb going off, or gunshots, or an alarm, or someone screaming your name. And it's not actually happening in the environment. It's just in your mind. You hear it. Other people around you can't, but it's very startling. It's not dangerous. It doesn't, mean anything is inherently totally wrong, but it's very startling and sometimes confusing for people. So, that's one sort of off-the-wall possibility. In other cases, people with things like seizure disorders, they can experience strange sensory experiences like, fuzzy, buzzing sensations, pressure, clicking, and sort of that buildup. When your brain is misfiring and it's leading to the electrical storm that is a seizure, you can experience a lot of strange things. So, given multiple possibilities, I would highly suggest that you talk to your doctor about this. It could be that a referral is necessary. Maybe you need to go see a neurologist. At the very least, they can run some diagnostics. They can have you do an EEG, electroencephalogram, which can look at your brainwaves and rule out seizure activity. They could do an MRI to look at the structure of your brain and rule out any kind of organic structural issues with your brain that could be contributing, like tumor or other things like that. They could also send you for a sleep study. If they suspect there could be something like that exploding head syndrome going on, they might send you for a sleep study where you're monitored as you're actually sleeping. Again, I'm not trying to scare you. I'm not claiming that I know that any of these are the culprit, but these are things to think about. It's not always a primary mental health issue. Sometimes there is a physical or neurological basis to it, and it can be helpful to just make sure that you're covering all the bases. Now, back to the question itself, another interesting aspect of it is you mentioned in your question that when your intrusive thoughts are directed toward a person, you said, and I'm quoting, you said it starts sighs or coughs. I'm not entirely sure what that means. I can see a couple possibilities as to what you mean here. One would be that when you have obsessive thoughts that center on other people, your compulsive behavior that's attached to that involves you coughing or sighing, which would be totally within the realm of normality for OCD. A lot of people with OCD have vocal tics that serve as compulsive behavior. So things like grunting, like or sighing or coughing or making like huffing sounds. And these ones definitely fall into that realm of needing to feel just right. I remember way back in the day when I was, even before I was like training to be a psychologist, I think when I was in high school or junior high or something, maybe probably high school, and taking a psychology class, I remember watching the old MTV show True Life. I have OCD, and someone on there, they called it huffing, and they had a compulsion where they would like make it sort of sound like that. And for them, they were like, no, that wasn't right. That didn't feel right. And they would keep doing it until they got the right satisfying sort of huffing experience. And then that would make them feel like they got enough relief from that. So, sighs, coughing, all of that totally within the realm of normal sort of OCD compulsions. However, there's another way of interpreting this, and I'm not sure which one of these it might be. So I'm going to just address both. The other way that I can read what you wrote is that when you have negative thoughts about someone, they start sighing or coughing. And that would fall under this umbrella of your thoughts impacting external events, like as if your thoughts control the world in some sort of way, which again, that would be more in line with psychosis than just OCD. So I'm not sure which it falls under, but I'm just trying to give you information to try to, conceptualize and better understand your situation. The one last thing that makes me wonder about psychosis versus something that would be more just OCD is the way the question was written. I did my best to sort of parse through what was written, but it was difficult to do. And a lot of times with psychosis, you can get disorganized thinking patterns or disorganized speech. And so it kind of just came off that way to me in a sort of qualitative way where it's almost hard for me to put my finger on, but it seems a little familiar. So that's another thing that makes me wonder about this. Whatever might be going on here, though, you are definitely experiencing some significant symptoms. It's getting in the way of your life. You're losing sleep. You're feeling upset by it. It's interfering. I think you could really use some help. I'm not sure if you're already getting psychiatric care or not, but I think that seeing a psychiatrist, so a medical doctor focusing on mental health issues, could be an essential piece of the puzzle. And they can help you with finding appropriate medications. There aren't too many medications that are awesome for OCD itself, but medications can certainly help with the anxiety component of OCD. And then if we are looking at something like psychosis, there are a lot of different medications that can help with that. There are many medications that can help reduce hallucinations and delusions. And one interesting thing is that many of those can also help you get better sleep, right? So for instance, there are a variety of medications called atypical antipsychotics. It's big, scary terms, I know, but they're newer generation medications that help with things like hallucinations, but they also tend to help with sleep. They make you a little bit groggy. And for some people, that's a good thing if you're, losing sleep right now. But I know I've mentioned a lot of different things. I mentioned psychiatry, neurology, and it might not be possible to follow through with all of those right away. If I made this sort of an order of operations for you, I would say first stop is go talk to your primary care. Give them as much information as you can based on the things you've heard from me here and your own experience. Maybe they will refer you out to neurology so you can get some of that baseline, physical stuff done. You get some lab work, make sure there's not some sort of infection going on, brain scans, EEG, stuff like that. Rule out any neurological basis. And if there's no basis for the neurological part, then the focus becomes primarily in psychiatry. In addition to just medication, a therapist can also help you out a lot too. Therapy is, very commonly used in OCD. There are different approaches, but a lot of them focus on what you call exposure and response prevention, meaning, allowing yourself to sit with the obsessive thought rather than trying to force it out of your brain. And in sitting with that obsessive thought, despite the urge to do so, trying to avoid engaging in that compulsive behavior. And that can help you build a better tolerance for it. It can help you kind of focus more on living your life rather than being so wrapped up in the obsessive thoughts and such. But yeah, there's a variety of approaches. Therapy can be very helpful in tandem with this other stuff. One thing you might do right now is start to keep a log or a diary of some type to just keep track of your symptoms as much as you can. That can make it easier for your providers, like your medical providers or family, anybody that's helping with your care, to understand what you've been experiencing and sort of put together patterns a little bit better. And then, of course, if, the things I'm talking about here, these sort of outpatient, therapy, psychiatry, if those things aren't doing the trick for you, you can go to a higher level of care. Rather than, say, going into the hospital, you can do something like an intensive outpatient program where you're getting treatment, multiple times a week very consistently. And it's just sort of a higher, more contact level of care. So a lot of stuff to think about. Overall, I really, really hope you can find some relief. I know it's hard to deal with these sort of things. And so I appreciate you trusting me with this question. And I hope that you can feel some relief. Feel free to enlist the help of your friends or family members that you can trust if you're having a hard time managing this on your own. I mentioned a lot of areas of follow-up, and that can be overwhelming, especially when you're struggling in this way. So don't be afraid to get some help if you need it. So thank you for the question. Really appreciate it. And before we get into the second question, I want to talk about our other sponsor, which is Air Doctor. Given the past few years and everything we've been through, it's probably no surprise that some estimates say that Americans spend an average of 90% of their time indoors. That's a lot, and I'm sure there's other countries that are not too far behind that. And aside from just the United States, the World Health Organization shows that 9 out of 10 people breathe air that exceeds their guidelines for safe pollution limits. If you're like me, your body doesn't like polluted air, especially when it comes to airborne allergies. I have terrible allergies, and in the area that I live, for one reason or another, it's been just a crazy allergy season. I've been an absolute wreck. You probably hear it in my voice from week to week. It varies a lot because my body varies a lot. And so the solution to that, at least one of them, can be an air purifier. So I'm happy to introduce Air Doctor as a sponsor this week. Air Doctor is an air purifier that filters out contaminants and allergens using an ultra HEPA, I never know how to say that. An ultra HEPA filter that removes nearly 100% of particles that are as small as 0.003 microns in size. So that's much smaller than most of the allergens that you're going to be encountering. So it's very, very good. It has that HEPA filter, and then it also has this big old chunky charcoal filter that you have to sort of prep before you do it. It's not difficult. You just unwrap it, put it back in, close it back up. It takes 2 seconds, but you can tell it's very substantial. And it's very powerful. It's powerful enough to circulate the air in a 630 square foot room 4 times per hour. So it's pretty good. One of my favorite things about the Air Doctor is the sound. It has what they call whisper jet fans, and they are very, very quiet. I started testing it out at about 10 p.m. when the kids were asleep and the house was totally quiet and no rustling. I couldn't even hear it from the other room. But on the flip side, you can crank it up. And if you crank up the power, it also makes a good sound machine. It's a very consistent sound, and the volume can be similar to a box fan or, quieter like a professional sound machine. So I could totally see a double benefit there of cleaning the air, but also having that white noise that you might want to use while you sleep. So if this sounds like it could be helpful for your situation, it's very, very easy to unpack and just get started right away with the Air Doctor. You might want to check them out. They come with a no questions asked 30-day money-back guarantee. So head over to airdoctorpro.com and use the promo code DUFF. And depending on the model, you can get up to 40% off. So you can lock in this fantastic offer right now, which can equate up to $300 off. That 40% can be up to $300. So go to airdoctorpro, AIRDOCTORPRO, airdoctorpro.com. Use the promo code DUFF. Okay, so with that said, let's go ahead and get into the second and last question here. It reads, Dr. Duff, I listen to your podcast and find such great comfort and information. I decided this year to focus on my mental well-being and have been having significant trouble finding a decent, reliable, relatable therapist. So far, I've had initial meetings with 2 therapists and a follow-up with each. Neither matched my needs. I had an initial meeting with a third who read instructions on an exercise for the follow-up and then summarily canceled the follow-up, and have changed a fourth time because of scheduling difficulties. I have a long-held issue with childhood trauma, raging, abusive, alcoholic father, beyond bad, and have done sessions of therapy throughout my life to get through the toughest parts. But I want to work on fixing me now, not my interactions and relationships. I'm in a companionate marriage, and I have to be okay with that. I have adult children who aren't as close as I would like. I have to learn to love me. Any questions on finding a super awesome provider like yourself? Thanks so much for all you do. So 2 things off the top. 1, thank you. I hear the compliments in there, and I very much appreciate them. It means a lot. And 2, wow, this sounds fucking frustrating. I'm frustrated on your behalf, and I'm sorry. I've seen firsthand, my wife tends to seek out, therapy more often than I do. And, seeing her go through the ringer of just like trying and not being able to find somebody, I feel the frustration secondhand, and I feel that on your behalf too. Like, you're trying so hard to find help, and, it can feel like you're basically getting nowhere, and that's not your fault. It's definitely one of the limitations of the mental health field. And of course, I'm speaking from, the United States perspective. I'm not sure where you live, or whoever might be listening where you live. But here, yeah, it's tough sometimes to find a good provider. And when you're struggling with your mental health, any barrier might mean the difference between getting help and not getting help. So unfortunately, finding adequate care isn't always easy and a seamless process. Therefore, some people just give up. So I'm very proud of you for sticking with it, for trying multiple providers, for not just throwing in the towel yet. It's frustrating, but I think it will be worth it in the end. It sounds like you're looking for someone that knows what they're doing, obviously, and can have sort of care and nuance in their approach. It sounds like you're not just looking for coping skills, basic stuff, but you want someone that can help you dive deeper and really come to terms with some things in your life. And that's going to take somebody that you can trust. It's going to take somebody that you can relate to. So yeah, one answer here is going to be continued trial and error. But I know that sucks, and that's not what you want to hear. Just continue. So another piece of advice that I would have is to just take your time and be really picky on your side. I'm not sure how you've been finding therapists, but if you've just been using, say, a list from your insurance company or asking for referrals, I would suggest instead you use some online search tools like Psychology Today, or you look at your state's, psychological association website, basically using some of these search engines that are out there to narrow things down a bit. I have some tutorials about how to do stuff like this. If you go to duffthepsych.com/find-a-therapist, I have a whole tutorial on how you would use Psychology Today to find somebody that treats your issue and also takes your insurance. But what I would suggest is that rather than just looking at profiles on Psychology Today, go a little bit deeper. Click through, visit some people's websites. If they have social media or anything else they put out there, look at that. Look at any means you have available to understand their personality and their approach. If they don't have a website or some sort of place out there that they're putting their information, to me personally, that's a red flag. And obviously there are generational differences with this. Some people don't care as much about a website. Some people who are, older and are doing therapy don't have a good website because that's just not their forte. But for me, the information that's out there and the way they express themselves openly, maybe on the internet or whatever platform, that matters a lot. So it's something that I focus on. You mentioned, how do I find somebody who's a provider like yourself? And so just as a sample, on my professional website, so not duffthepsych.com, but robertduffphd.com, which is where you can find stuff about my therapy, testing, stuff like that. Basically my clinical practice. On the therapy services page, I have the following information written. I'm just going to read it verbatim. The biggest complaint that I hear from people about their previous experiences with therapy is that their therapist didn't do anything. That's not me. I have a very active, solution-focused approach. Not only do I want to be there for you as an empathic listener and learn to speak your emotional language, but I also want to help you take action. To me, that means helping you identify the problem and find skills and strategies to make an immediate impact on your situation. My approach is down to earth and grounded in reality. I draw heavily from cognitive behavioral therapy, which means that we will be examining your thought patterns as they relate to your feelings. And I also integrate elements of psychodynamic, behavioral, and dialectical behavioral therapy. Feminism and social justice are both personal and professional values, which means that my work considers your unique background and the power dynamics at play both inside and outside the therapy room. LGBTQ+, kink, and polyam friendly. Lastly, as a clinical neuropsychologist, I'm also uniquely equipped to work with therapy clients that might have neurological differences caused by brain injury, stroke, or advanced age. If you'd like to see if we'd be a good fit for one another, shoot me a message to get the ball rolling. So all of that is on my, services page for therapy, right? And with that, I think you could get a pretty damn good idea for me, right? You can see what I'm about. That shows a lot of my personality, shows a lot of my values, my approach. And so with that, you can get a pretty good head start in understanding more about me as a psychologist. And then, of course, on my website, I also have links that go out to my other stuff, right? So on my About page, I have links that go out to, my public social media profiles, videos on YouTube, podcasts, stuff like that. So you can find even more and get actual samples of me out there to know what I'm like. And so, I think that this is a great way to get to know me before ever actually meeting me. And it does, in my experience, help to accelerate the development of that therapeutic relationship. A lot of people who may be listening right now, shout out to you if you are therapy patients of mine. And, when we got started, it was a lot easier to sort of hit the ground running because we had some degree of an existing relationship, even though we hadn't met yet, just through the stuff that I put out there. And not everybody is like me. Not everybody is comfortable having a social media presence or doing a podcast or making videos, what have you. But still, they should have some stuff out there. And so my suggestion for you would be to take the time, dig around, do some research, and find people that really resonate with you. Of course, depending on where you're looking, like if you need to be in your local area and see them in person, that's going to limit things a little bit. If you're in the United States, you can see anybody within your state. So anybody within the state you live in, as long as they're licensed in that state, could see you virtually. Or in person, obviously. But yeah, you can find people. And from there, what I would suggest is maybe just reaching out through email if possible. Or on Psychology Today, they have a messaging system on there. But basically probe, try to just throw out a feeler before committing to an in-person meeting. And you might even mention some of the problems you've been having, right? So like if you were to send a message or an email to a potential therapist, you can say like, I was looking at your website and I feel like I could really resonate with your approach. I was wondering, are you accepting new clients? And then you might say like with XYZ insurance, because sometimes that's important to clarify. And then you could say, I've had trouble finding reliable therapists and good fits. So please let me know. Feel free to let me know if you do not have availability. Otherwise, I'd be really interested in setting up an initial meeting, and you can let me know how to do that. Right. So just kind of letting them know you've had some issues, like don't screw around with me, be honest, and, see if we can make something work. They may or may not get back to you, but that's easier than, going more steps ahead. There are also these days more and more companies out there that have a network of providers, and they can potentially help you find someone within their network that might be a good match. Now, these kind of things are still somewhat in their infancy. There are some hiccups that can happen, and it can be a bit hit or miss with the providers. But at least it takes some of the work out of it for you, right? If you're just like, find someone for me, let's try it out. You try it, doesn't work, but yeah, that didn't work. Find someone else for me. So they're doing that legwork at least, right? But if at all possible, I do encourage you to do this research on your own. And then, as I said before, there is still a degree of trial and error. So I want to encourage you to stick with it. I know it can be frustrating. I know it can be hard to have a few failures to launch. But, think about how you consider this versus how you regard other services in your life. Like you wouldn't necessarily bat an eye at having to try a few different hairdressers or massage therapists or anybody that can provide a service to you, right? You kind of recognize sometimes it takes time to find a good fit. And maybe you really care about your hair or your nails or who's giving you acupuncture or whatever. And it's worth it to find that good fit. And for you, especially since you're talking about untangling some significant stuff from your past, it might pay to have some patience. You're not looking for a quick fix, so give it the proper time. Find the best fit that you can, and that can be a great place to begin. So yeah, that's kind of what I have for you. A little bit of a short and sweet answer for the second one here, but I do hope that helps. And best of luck to you. And with that, that has been episode 340 of the Hardcore Self-Help Podcast. Thank you all for listening. If you would like to send in a question for the show, please send me an email to duffthepsych@gmail.com. And if you would like the show notes for this episode, go to duffthepsych.com/episode 340. All right, guys, you take care of yourselves. I'm going to edit this up and then pass the hell out. Take care.